Preparing for an operation. It can be very difficult for patients with developmental disabilities to understand and cope with invasive healthcare appointments. Often, patients are managed with restraint and swiftness, leaving them traumatized and more mistrusting of healthcare professionals. Here are some things you can do to get yourself ready for an operation. Get a sneak peek. Many hospitals offer a pre-operative tour program. Ask if your facility does and schedule one. This way, you can visit and see what the hospital looks like before the operation. It's a great opportunity for desensitization to the environment. Some facilities may also offer a pre-op tour video on their websites. If the facility does not have a tour, ask if you can visit the space before the operation to know what to expect and to look for any potential roadblocks to success. Avoid sensory overload. The medical center environment can be overwhelming. It's often noisy, bright, and busy. Some people may shut down or act out when entering an environment like this. It's important to know what your specific stressors are before coming to the medical center. Some things may be changed to help reduce the stress level, such as reducing the brightness of the lights or the level of the noise in the room. Role play. Ask your healthcare provider for some surgical hats, masks and gloves, and an anesthesia mask to practice with. Explain why they're used and try them on. Explain that these are worn by doctors and nurses to keep germs out of the surgery center. Talk about it. At home, begin talking about the operation a week or so ahead of time, depending on your temperament and anxiety level. Some people will only tolerate hearing about it a day or so ahead of time. You may consider creating a visual schedule for rehearsing at home and bring it with you the day of the procedure. Learning about what to expect in a familiar communication style and in your own home can be very helpful.